This is Mel Majoros, the Cancer Warrior, and this is how I think we should do breast cancer awareness differently. One of the big things that affect breast cancer awareness are, especially during October. I was diagnosed in September, and everything is pink. Everything in October is pink. You have pens, people put ribbons on kitty litter, cat food, toilet paper, and you're wondering, how does this make me aware of breast cancer? And, it really doesn't. I think we're all aware that there's breast cancer, and I think putting a pink ribbon on something doesn't necessarily make you more aware of it. I think the money that is raised should go more towards helping people understand once they have cancer, what they can do nutrition-wise, exercise, how that can help you as far as just not getting cancer, because there's a lot of things that you can do to, it may not help you not get cancer, but it will help you before you get cancer. For example, I work out at the gym as much as I could before I was diagnosed, and the doctors told me, because you worked out so much, because you're watching how you ate, you went through your chemo and your radiation and your cancer treatment a lot better than most people would. The other thing we talk about for awareness is invisible illness. Like, I have chemo brain right there. I was just like, what am I going to say? It's hard when you're trying to find. Chemo brain is like if I look at a pen and I see, oh, that's a pen, my brain will not tell me, oh, that's a pen. So I'll be searching for the right word, and to the outside world, the people who don't know me may be like, why is she not talking? What is wrong with her? It's things like that we have to deal with as cancer survivors. Also, depression. It's hard, when you're going through this, if you feel completely alone. I had times where, I didn't want to talk to my fiance because he doesn't have cancer, and what the hell does he know? And then you didn't want to bother other people because then they'd be thinking, oh, there's Cancer Girl again. What's she going to talk to me about this time? And, realistically, your friends aren't going to go, oh, I don't want to talk to you because you have cancer and I don't want to hear your problems. You have to realize that there are people there that you can reach out to, whether you believe it in your mind or not, because, like I said, depression is a huge, huge invisible illness that's related to cancer survivors. And just finding somebody, even your fiance, if you don't think you can talk to somebody who hasn't had cancer, find somebody who has cancer, like I said, that person that you had talked to before, or even your pastor or just a friend, and be like, you know what, I'm just not feeling quite like myself. And once a friend of yours talks to you, even a cancer survivor may say, you know what, we all feel the same way. And I had a cancer survivor say that to me. It's like, I feel completely lost and helpless, and I don't know what to do. And I was like, I'm not the only one. Are you kidding me? That's just a great godsend, just reaching out to other people in the cancer community, helping out that way. That's what I do. Is anyone who asks me a question, I'm willing to do anything except shave my head for a cancer survivor, because that was kind of traumatic for me. But, just that's part of the awareness I think we need to reach out for, not putting pink ribbons on everything and color everything pink, because I think we're all aware that there's breast cancer. Now we just have to do something about it.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.